ICU or ER? Which nursing path is better in Southern California? Both may care for life-threatening conditions, but their workflow, qualifications, and career opportunities are different. ICU nurses provide sustained care for patients with serious, complex illnesses or injuries. Depending on the unit, they may manage ventilators, advanced monitoring devices, and medications that support blood pressure. ER nurses frequently assess patients before the diagnosis is known. They perform a focused assessment, determine how urgently treatment is needed, begin stabilization, and reprioritize when a more critical patient arrives. The main difference is this: ICU nurses monitor small changes in critically ill patients over time. ER nurses make rapid initial decisions across many different emergencies. In California, critical care units, one licensed nurse can be assigned no more than 2 patients. In the general ER, the limit is 4 patients. For critical care ER patients, the limit becomes 2. A critical trauma patient requires 1 registered nurse for every patient. Neither specialty is easy. ICU nurses usually have fewer patients, but each may require intensive monitoring and life support treatment. ER nurses may face faster turnover, undiagnosed conditions, and priorities that change within minutes. What do current Southern California employers require? A recent Cedars-Sinai ER opening required a California registered nurse license, advanced adult and pediatric life support certifications, and at least 1 year of recent acute registered nurse experience in the specialty. Additional pediatric emergency and trauma credentials were required within the first year after hiring. Graduation from an accredited nursing program was required, while a bachelor's degree in nursing was preferred. A UCLA Health ICU float opening required a California registered nurse license, a bachelor's or master's degree in nursing, and 3 years of ICU experience, or 2 years of UCLA Health ICU experience. Advanced life support, national certification, and extensive acute hospital critical care experience were preferred. Ask about the unit's precepted clinical orientation. This is unit-specific training guided by an experienced nurse who helps you learn the procedures and equipment. If a new graduate application requests recommendation letters, choose nursing professors, clinical faculty, clinical liaisons, or current clinical supervisors or managers who can describe your nursing potential. Previous phlebotomy or electrocardiogram experience may be included as relevant healthcare experience. However, these openings did not list those certifications as substitutes for registered nurse licensure, life support certifications, or specialty experience. Your long-term goal also matters. If you want to become a certified registered nurse anesthetist, ICU is generally the more direct pathway, because nurse anesthesia programs require at least 1 year of qualifying critical care registered nurse experience. Other critical care settings may be considered when applicants demonstrate the required competencies. ER may be a better match if you prefer rapid assessment, triage, varied patients, and frequently changing priorities. Bottom line, choose ICU for sustained critical care monitoring and nurse anesthesia preparation. Choose ER for rapid assessment, stabilization, and variety. Which environment fits your skills and long-term goal, Team ICU or Team ER?